Hello, my name is JNelson, and I'm here today to talk to you about diabetes. Diabetes is a disease that affects many humans throughout the world. It is ranked as number 10 in the world of the top diseases that affects many people. Even though there is no cure yet, we are still vigorously working towards ideas and treatments to help keep the disease under control. The things that we will be discussing today include exactly what is diabetes and the different types of diabetes that there are throughout the world, the symptoms that come along with diabetes, what risks are associated with the disease, as well as the different complications that are caused by diabetes. We will also take a closer look at prevention and the treatment options. So what exactly is diabetes? It is best classified as a disorder of one's metabolism and how the body uses digested food for energy. The inability to produce any or enough insulin, resulting in elevated levels of glucose in the blood, can best be described as diabetes. Many people who have diabetes also have high glucose as well as hyperglycemia. Before we can fully get an understanding of diabetes, we must first take a closer look at insulin and glucose. Insulin is a hormone that comes from the pancreas, which is located just below the stomach. The pancreas's main job is to release insulin into the bloodstream, where it moves about the body. As the insulin circulates throughout the body, it aids in lowering the amount of sugar in the bloodstream. Glucose, on the other hand, is a sugar that acts as a source of energy for the cells that make up muscles and other tissues throughout the body. The body's main source of glucose comes from the food that is consumed as well as the liver. The liver is a place that the glucose is stored until the body needs more glucose. At this time, the liver then releases glucose back into the body. Now that we have an understanding of insulin and glucose, let's take a closer look at the different types of diabetes. The cause of type 1 diabetes is undetermined. However, it is known that the immune system attacks and destroys the insulin-producing cells in the pancreas. The breakdown of beta cells typically takes place over several years before it is actually detected. This type of diabetes usually occurs in children and young adults. However, it can appear at any age. When it comes to type 1 diabetes, heredity also plays a large role. The genes that are passed down from the parents can carry the instructions for the body cell function. If these instructions are not written correctly, they can lead to the formation of diabetes. The most common type of diabetes is type 2. This type of diabetes is caused by a few different factors, including insulin resistance, which is where the body's muscle, fat, and liver cells do not use insulin effectively. This type of diabetes is most often found in middle-aged and older people who are typically overweight or obese. Due to the growing amount of youth-aged children that are overweight, type 2 diabetes is starting to be found in this stage of life as well. Since most overweight people have excess abdominal fat and are not physically active, and muscle, fat, and liver cells stop responding properly to the insulin in the body, sending the pancreas into overdrive. Due to this, pancreas is not able to make enough insulin, causing the amount of sugar in your bloodstream to build up. As I stated earlier, diabetes is the 10th most common disease in the world, so we should take a look at some of the symptoms that come along with this disease. When the cells do not use the extra sugar in the blood, the sugar gets excreted in the urine. Since the sugars can't come out by themselves, it soaks up the urine and leads to more frequent urination by those that suffer from diabetes. Due to the frequent urination, the body suffers from water loss that is above normal, thus resulting in an increase in thirst and can also cause drier skin than normal. Another effect of the dehydration of the body is blurred vision, which is caused by the levels of water and glucose in the eye. These levels fluctuate depending on how dehydrated the body gets. Not only are there symptoms that come from dehydration and the effects of too much sugar, there are also symptoms from low insulin and lack of sugar. Hunger is one of these symptoms that is a direct reaction from the body missing the insulin that typically takes in sugar. Even though there may be already sugar in the blood, Due to the low insulin level, the sugar is not detected. When the sugar is not being used, it also leads to insufficient cell growth and repair that is needed to produce energy, leading to exhaustion. When the body is not able to properly use the sugars, these sugars are eventually lost by the kidneys through the urine. When the insulin in the body is not functioning properly, the sugars in the body can increase, resulting in poor function of the white blood cells. When these levels are elevated, bacteria and other disease organisms thrive, making it easier for diabetics to get sick. Once most diabetics become ill or suffer a cut or bruise, it takes them a long time to repair. With diabetes comes a number of short and long-term risks if it is allowed to get out of control or the proper steps are not taken in treatment. The short-term risks go right along with the symptoms of the disease, such as fatigue, dehydration, increased appetite, which leads to weight gain and blurry vision. When it comes to long-term risks, however, these are typically developed gradually as you have less and less control over your blood sugar. Eventually, some of these risks can be disabling as well as life-threatening. If you have diabetes, you are more likely to have heart disease, a stroke, and other cardiovascular diseases. Nerve damage can also occur due to the excess sugar damaging the walls of the blood vessels. The legs are mostly affected by the nerve damaging, causing tingling, numbness, or burning that could eventually lead to the loss of all feeling in the lower legs. Kidney damage can also occur, and when severe, kidney failure or end-stage kidney disease can take the lives of some patients. Other long-term effects include eye damage, various skin conditions, and hearing loss if the disease is not treated and handled properly. Taking a closer look at some of the complications of diabetes, we can see that these patients can form cataracts as well as glaucoma in the eyes, making it difficult for them to see as they age. In the heart, thickening of arteries can start earlier in life and lead to high blood pressure and high cholesterol, possibly starting at a younger age, depending on when the diabetic patient was diagnosed. Nearly 1/3 of kidney failure patients are diabetics. Thus goes to show the cause and the effect that diabetes has on one's kidneys. Muscle weakness can also occur, as well as loss of feeling in the limbs due to nerve damage from the high glucose levels. Many diabetic patients have problems with their feet and circulation, and if gone untreated, many can also have complications that could result in the loss of the feet, the toes, and some have even lost their legs. Poor immune systems function can also lead to the slow healing of cuts and bruises, which can lead to infection and potential loss of limbs. Since diabetes can both be acquired and inherited from birth, it is hard to approach this disease from a prevention standpoint. Many studies show that such things as weight loss, healthy eating, and increasing one's physical activity can drastically reduce the progression of type 2 diabetes and are important in controlling type 1 diabetes. If these lifestyle changes are not enough to help gain control on diabetes, there is also a number of medications to control blood glucose levels, high blood pressure, and cholesterol. When it comes to the treatment of diabetes, the main medication that is used by a vast majority of the population is insulin. There are many different types of insulin. However, all of them have to be injected into the fat under the skin in order to make it into the bloodstream. These injections can be done using a syringe, an insulin pen, and an insulin pump. The insulin pump itself is a small machine that can be worn on one's belt or pocket and pumps insulin through a tube and needle under the skin and can be worn for several days at a time. We have covered many things today, from the different types of diabetes, the symptoms to watch for, the treatments, as well as the risks that are associated with diabetes. Having it be the 10 most common disease in the world, there is still so much more to learn, in hopes of one day finding a cure that will no longer take the lives of many affected of diabetes.